talking to Min Deng, who is the lead author on the article Expertise in Head and Neck Cutaneous Reconstructive Surgery, published in Derm Surgery Journal in June. Hi, Min.
Hi.
I wanted to ask you, why is this an important article for the dermatologic surgeon?
Well, the background behind this article is that dermatologic surgery is really a very evolved field by this point. We've had many surgeons train specifically within the field of reconstructive surgery, Mohs surgery, but I think that there's always been this misperception within the House of Medicine that dermatology is still a non-surgical field. And so we really wanted to see if we could try to quantify the expertise within the dermatologic surgery field in a way that was scientific, robust, and in a way that made sense for our specialty. So this was really the impetus for us to start this project.
So you wanted to show that dermatologic surgeons have evolved and do many reconstructive procedures. How did you go about showing that, and why did you show it in this way? Why did you choose this way?
Right. So there's actually been many prior studies looking at kind of quantity. So how much surgery do dermatologic surgeons do? So those have already been published. So back in 2008, 2009, more recently as of 2018. So what those studies kind of showed is that, dermatologic surgeons perform 95% of all surgeries for skin cancer. And we, by far, are the specialty that performs the majority of repairs. So linear repairs, flaps, grafts, and on the head and neck, we perform over 2/3 of these reconstructive surgeries. So when we try to quantify, I think the issue of quantity has already been addressed. And so those have already been addressed through the CMS database. We thought about looking at quality, but when you look at how good a procedure is or the quality of a procedure, it's a very subjective and very difficult, tangible thing to measure. And so we actually thought about it in a new way, which is, how do you look at who is contributing, who is creating innovations, who's writing the new articles to try to advance the field, and so that's how we kind of went about looking at it that way. So when we wanted to look at creativity or innovation and contributions to the peer-reviewed literature, we wanted to make sure that we went about researching this article again, in a very comprehensive and fair manner. And so one of the key things is that we try to have lots of search terms that were determined a priori. So we didn't just go through and cherry pick the articles that we liked. We really, sat down, blank canvas and said, these are the terms that are commonly used in the reconstructive literature. So even within the field of advancement flaps, for example, we named off specific advancement flaps. So we identified 6 overall large categories: suture technique, linear repair, advancement flap, rotation flap, transposition flap, and interpolation flap. And then within each of those categories, we had many, many subterms that were searched for. And so when these were all determined a priori, you're less likely to have bias or to cherry pick the articles that you're going to review and publish on.
Sounds like a huge challenge. How many articles did you access? And how did you tell us a little bit about what it was like to go through all that data?
Absolutely. So this article came about was the brainchild of many authors, many immense co-authors who put in a lot of hours, a lot of work into this. So really it was a group effort. We collected, I think, around 70 or 80,000 articles from our initial search terms. And then, once we got rid of duplicates, that came out to just under 70,000. And then so from those 70,000 articles, these were assigned, and each group of articles was assigned to at least 2 reviewers, so that there was an opportunity for 2 people to review the article. And if 2 people, if 2 reviewers did not agree on whether an article should or should not be included, then that was then given to a 3rd reviewer to review. So we tried to be as robust as we could, but it was definitely a huge undertaking.
And tell me a little bit about what you found.
Yeah, so we looked at all the articles from January of 2000 through the end of 2015, and again reviewed almost 70 or 80,000 articles. And what we found is that the top 2 contributing specialties within the medical literature for cutaneous head and neck reconstructive surgery are plastic surgery and dermatologic surgery. And within the field of, within suture technique, linear repair, dermatologists by far published the majority of those articles, something like 50%. I think plastic surgery was the secondary contributor in those categories, and they contribute about 20% within suture techniques and 22% within primary linear repairs. For advancement flaps, plastic surgery and dermatologic surgery were almost even in terms of the number of, in terms of which specialties senior authors belong to. So for advancement flaps, 40.5% were plastic surgeons and 38.1% were dermatologic surgeons. So almost on par. For rotational flaps, 39% were published by plastic surgeons, and 34% were published by dermatologic surgeons, again, it's the top 2. And for transpositional flaps, 47% versus 32%, and for interpolation flaps, 40% and almost 30% were dermatologic surgeons. So within each category that we looked at, dermatologic surgery is really either number 1 or number 2 in terms of the contributing specialty to that field and to that specialty, to that article.
How did you identify the specialty? So in addition to looking at all those articles, you had to identify the specialty of the lead author, I
Right.
guess. How did you do that?
Right. So we did that a combination of ways. Some of these articles were international, and so for international articles, we basically would look at their affiliations and also try to search them and see if we could find an affiliation directly, even outside of what they had written as their affiliation. And then there were. So in the vast majority of cases, that worked for our specialty, for our senior authors. So most of people who said they were dermatologic, associated with departments of dermatology, were dermatologic surgeons with, board-certified dermatologists and fellowship-trained Mohs surgeons. People in other specialties tend to be boarded in those other specialties, so you can definitely search for them that way. There were very few instances where a senior author was a medical student. So in those instances, we would then use the primary author, the first author, and count their specialty as the senior author specialty.
So one last question. How do you think that these results should impact the way we as dermatologic surgeons discuss options for closure with our patients? And it's a little bit of a leading question, but what do you think this study does for us in that discussion?
I think that I think it really gives us something quantitative, again, to be able to discuss with our patients and even with our colleagues within the House of Medicine, that shows that, there may be misperceptions that are truly misperceptions, because in this day and age, and really since the turn of century, and perhaps even before, dermatologic surgeons are really some of the primary contributors to this field of study and to this field of reconstructive surgery. So I think that when I counsel my patients, I tell them, I'm fellowship trained, I've done X, Y, Z, thousands of these procedures, but I think it's also helpful for them to hear that we're the innovators. We're the ones who are coming up with new techniques and new pearls and new ways of doing things and kind of finessing some of the things that have already been done.
Wonderful. Thank you for your hard work in this endeavor, and everyone should read the paper. It's really great.
Thank you so much.